Hello, my name is Katie Henches, and I'm here today to talk with you about the child health improvement through computer automation system in child neurology. So, like I said, I'm Katie Henches. I'm the director of programs for an organization called the Child Neurology Foundation. We are an organization focused on improving the lives of children and their families living with neurologic conditions and the medical professionals who support them. I'm here today with our partner, Dr. Steve Downs. I will turn it over to him to introduce himself.
Hi, I'm Steve Downs. I'm a professor of pediatrics at Wake Forest University and the originator of the CHICA system. I am also the CEO of Digital Health Solutions, a company formed to make CHICA and CHICA-CN available broadly. The problem that we were trying to address when we first worked on the development of CHICA was that we knew lots of services that were recommended to physicians were not being done. And one of the big reasons for that is that it is hard to keep track of them. There are too many recommendations to follow over time. And so we built CHICA. This is an example of 7 recommended services in general pediatrics where we first installed CHICA. And you can see that the rates at which these things were being done in clinics where we measured them was suboptimal. With the introduction of CHICA, however, next slide, you can see that we were able to drive those rates much higher. And you'll see how this works shortly, but we have had tremendous success with this in pediatric practices, and we're looking forward to doing the same in child neurology. CHICA has been proven to be effective in the pediatric realm. We've used it for over 20 years and have results of over 50 publications showing improved quality of care. For example, we increased autism screening from 0 to 100%. We tripled the rate of developmental screening. We increased proper, that is DSM compliant ADHD diagnosis by 8-fold. The Child Neurology Foundation partnered with us in 2018 on a SUDEP project, that is a pilot project to implement CHICA in 5 of our primary care pediatric clinics with a new module that was designed to prompt physicians to discuss sudden unexpected death in epilepsy or SUDEP with patients and their families. And we found that by just adding this module to the existing CHICA system, the rate of conversations between physicians and families about SUDEP went from 21% of the time to 46% of the time, so more than doubling.
Because of the success of CHICA in the primary care space, the Child Neurology Foundation decided that we wanted to partner with DHS to produce a child neurology version of the system. So we built this clinical decision support system to address guideline recommendations in child neurology over the past 3 years. As part of that project and at the end of the build, we are currently doing research projects using the system through the rest of 2023 with current partners, which includes Norton Healthcare associated with the University of Louisville, and then also Wake Forest University. We are really excited that we now have an opportunity as well to launch the system at 2 new sites to do research or quality improvement and see how we can improve the lives of families using this system more widespread through the end of 2024. So with that, let's talk a little bit more about the benefits of using this system. What are the unique aspects of it? Why is this something that you would want to consider at your own institution? So this is an effective, proven clinical decision support system. We designed it to have currently 25 child neurology quality metrics or guidelines that use accessible, printable patient education in both English and Spanish. There's also an opportunity to get free tablets to use for collecting pre-designed patient questionnaires in both English and Spanish that then influence what is discussed during the visit with the patient and family. There's the ability to streamline and standardize note-taking across the entire clinic. There's also easily accessible data for quality improvement or research projects, and it is a seamless web-based connection with Epic using FHIR. So ultimately, the goal of this system is that we want to reduce the time spent documenting in child neurology and promote adhering to guideline or quality metric recommendations. So let's dive a little bit more into how CHICA actually works.
So in the workflow, when a child comes to the clinic, they are given an electronic tablet, and that tablet uses the Epic MyChart to authenticate the patient, and then the patient is shown 20 questions. The 20 questions are displayed 5 questions per page, 4 pages on the screen. They can toggle back and forth between English and Spanish. The questions are not the same for every patient. The questions are selected by the computer based on data that are available in the electronic medical record, and they are prioritized so that each patient is asked the 20 most important questions for that particular patient based on their diagnosis and other issues that have been identified in the patient's medical record. The patient goes through these questions and answers them yes or no. So for example, we show one here blown up that says, have you had any seizures with stiffness or jerking in the last year, which is a validated screen for convulsive seizures. And it says, I can explain my health needs to others, which is one of the milestones in achieving transition to adult care. Next. So after the patient has completed this, the tablet questionnaire, which takes on average about 4 minutes and is typically done in the waiting room, during the physician visit, the physician has access to an agenda, which is displayed as a window within their Epic system. And the agenda contains 6 items that the physician should address, and those items are based on what's in the electronic medical record, including the patient's responses to the questions that they answered in the waiting room at this visit or at previous visits. So, for example, I've highlighted one of the questions here, and for this little demo, the patient's first name is DHS. DHS reports a history of convulsive seizures lasting 3 minutes or more, or clusters or seizure clusters. This indicates the need for rescue medications such as midazolam or diazepam. And you can see that each of these questions has up to 6 check boxes in which the physician can indicate how they responded to that particular item. All of this information at the end of the encounter goes back into CHICA so that CHICA can reason about this information down the road. Next. The physician also has access to patient-focused education. That the handouts are available for each of the 6 agenda items that are presented in the physician agenda. However, the physician also has access to all of the handouts that CHICA produces. The physician can choose which to print and share with the family during the visit, and the handouts are available in English and Spanish, and they're written at a middle school or less reading level so that it's accessible to all families. You'll notice that the handouts also have QR codes which can direct the family to further information that's available on the Child Neurology Foundation website. Let me hand it back to Ed. Oh, let me mention one other thing. At the end of the visit, after this slide, please, Katie. At the end of the visit, the physician, that CHICA generates a prose version of all the data that were collected, and that the physician can then pull into his or her note and edit as they like, so that CHICA is actually writing a portion of your note for you. And the top portion that you see here is simply the answers that the patient had, or the patient or the patient's family had to the questions on the tablet. And then each of the physician's responses to each of the different prompts is written out as a note. So I've enlarged one of them that says disease management. Patient reports a history of convulsive seizures lasting 3 or more minutes, and then goes on to say what the physician did about that. Okay, next. The CHICA's addresses, as Katie mentioned, a wide range of topics. For the patient who is arriving in the clinic for the first time and whom we have no diagnostic code, the caregiver will receive a neurologic review of systems on the tablet, which will ask about a wide range of topics to help the neurologist address problems or symptoms that have come up. And this covers things from CNS infection, concussion, fainting, headaches, numbness, paresthesias, seizures, sleep problems, swallowing problems, talking, unexplained movements, vertigo, vision, hearing problems, walking problems, or weakness. In the epilepsy realm, we have referral to an epilepsy center for surgery or alternative therapies, rescue seizure medication, sudden unexpected death in epilepsy. Under tic disorder and Tourette's, we screen for ADHD, OCD, and ODD. For headaches, we talk about migraine preventive therapy, modifying lifestyle, and treatment for acute attacks. Next slide. We also cover a range of topics in muscular dystrophy about cardiac and pulmonary function monitoring, nutritional status, when to prescribe corticosteroids, and testing for an appropriate DMD mutation. We have a range of cross-cutting items that apply to most children in child neurology, including adolescent depression screening, genetic testing, global developmental delay, GI symptoms, which are, as you know, rampant in the child neurology population, neuropsychological and neurodevelopmental surveillance and screening, school problems, transition of care to adult care, and maltreatment screening. So a wide range of topics. Next. So let me hand it off to Katie, who's going to talk a little bit about the next processes.
So just a little bit of background about CHICA installation details. This is a part of the Epic App Orchard. So it is currently only available in Epic. The application itself authenticates directly from MyChart. So it's accessible via web browser, on a tablet, phone, or in MyChart itself. The patient fills out a brief survey, like we've mentioned a few times, in the waiting room or via MyChart if they're doing telehealth. And the survey itself is customized based on what CHICA-CN already knows about the patient or what they don't know about the patient. It then launches a window in Epic, and it displays the physician visit agenda for them to review. And there is integration that's written for clinical notes and flow sheet rows. So a little bit about the integration process itself. What does this partnership look like that we're hoping to do with 2 new institutions in 2023? So for now, we are looking to recruit 2 new institutions who would be interested in implementing CHICA-CN at their site. 2023, for the most part, will be dedicated to contract negotiations, going through security reviews, and then preparing the administrative staff for the process, because there is quite a bit of the workflow on the administrative and front desk side of things that needs to happen. All of 2024 would be dedicated to the installation phase and the research phase. So we would conclude training of doctors and administrative staff very early in 2024, hopefully, so everyone's prepared to use the system. We would actually go through the installation process for the system, which is fairly quick to do. And then we would set up front desk processes for collecting questionnaires on tablets, make sure that is ready to go. And then throughout the entire process, we would be able to make updates to CHICA-CN based on feedback from users. So we would be regularly surveying and meeting with administrative staff and doctors to ensure that the system is responsive to their needs and the needs of their patients. The research or quality improvement phase is going to be running alongside this. We will be expecting whatever institution integrates this system into their practice to actually be doing a project to show the impact of CHICA-CN on their clinical care. So as part of the process, we would ask the institution to propose what project would make the most sense for their patients and physicians, whether that's a research or a quality improvement project dedicated to at least one of the algorithms that Steve just talked through. So one topic area. And then we would ask for an assessment of the impact from that research project or quality improvement project to see how either physician behavior was changed or improved patient care. The project itself and use of CHICA-CN would conclude at the end of 2024, and we would enter into discussions with the institution if you would be interested in continuing to use the system going forward after December of 2024. So the partnership opportunity itself through this entire year and next year would include a $25,000 grant that would be provided directly to the institution. Up to half of the grant can be used towards installation costs of the system. However, the institution is also required to do a research or quality improvement project from beginning to end using this grant as well, or additional funds within the institution. We'd really like to partner to see how this changes impact and make sure that the system itself is continually evolving and being improved to meet the needs of the community. So for next steps, if you're interested in learning more and continuing down the process of seeing if you could become a partner on this project, in order to be considered a potential site, we do need buy-in from your institution. We need to know that the chair of the neurology department understands the project and is interested in using it for the entire department or clinic. We need to know that senior representatives from administration, whoever is going to be involved in the actual decision-making process of deciding to use a clinical decision support system, such as a COO, CMIO, or other senior representative, understands the project. We'd want someone from clinic operations, from the administrative side, kind of boots on the ground understanding of how this is going to impact workflow to be included. And then we also want someone who's going to be a decision maker in the contract signing process to be included in the next phase of learning more about this project. The two institutions that we select, this is a first come, first serve basis. So selection of the two sites who are going to receive the grant and be able to access the system for free will be based on how quickly a contract can get signed. So we do encourage you to reach out as soon as you can to coordinate internally, share this video with your colleagues to make sure if you want to continue down this process, they're aware of what you're interested in exploring. So with that, if you want to learn more, please feel free to reach out to us. You can contact the project manager for this project, Cindy Wright. Her email is on this slide. If you would like to schedule a meeting to discuss further, we will reach out to you and we will ask that not only you, but other decision makers that I've just listed are included in that first meeting. So with that, we look forward to hearing from you. Thank you so much.
Thank you.